Welcome to this webcast, which is part of the LeadWire series on circadian rhythm and health. I am very pleased to be joined by Eric Hoffman from Binghamton University. Professor Hoffman, many thanks for taking the time today.
Thank you. A pleasure to be here.
Professor Hoffman, how big of a problem are modern lifestyles for children's sleep schedule?
Well, the short answer is we don't know. It's a challenging thing to study. Most sleep studies are done in hospital settings where you come into a sleep lab, and usually on adults and often on people that have health conditions or in some sort of formal study like staying awake at night or night workers. But that by definition becomes few people studied and mostly adults. It almost becomes inappropriate to have children stay overnight in the hospital all the time when they're trying to go to school or whatever. So children's studies are tough to do. So the alternative is to do a population study. So look at a lot of children and try to study sleep patterns. And there are some activity monitors and sleep monitors that are increasingly starting to be used, and you can send them home with the children. But that again, in children and lots of them, that can be challenging, even on ethical grounds. And what would be better is if you actually could study their blood at the same time, or some fluids, so you can see their cortisol rhythms. Because sleep patterns is one thing, but there's also the hormonal basis of sleep, which is based on fluctuations of cortisol. And ideally, you'd like to study that at the same time. So a lot of those studies really haven't been done, and it's challenging to do, particularly in children.
Can you also tell us more about the findings from your recent research on circadian rhythms and children's health?
Well, our goal was to carry out a population-based study of children and look at their hormonal regulation of cortisol and how that might couple to measures of health, metabolic syndrome, sort of type 2 diabetes type features. As you know, children are becoming heavier and heavier with time. It's often coupled, we think, to lifestyle and lack of exercise and too much screen time. But we really wanted to study this in truly a population. So we worked together with the University of New England in Maine. Paul Visich is the professor there. And there were 2 elementary schools that were collaborated with us. So the entire elementary school participated in our study. So all the classes took buses to University of New England, and we on 650 kids in 4th grade and another 650 kids in 5th grade, so 9 to 10 years old. And the University of New England staff got a lot of fitness measures, metabolic syndrome measures, obesity, blood pressure, lipid levels, so your good lipids, HDLs, your bad lipids, LDLs. And then we worked, my lab worked with the parents directly to get 9 cortisol measures from each child. So right as first when they woke up in the morning, what we did is ask the parents to collect saliva and then freeze it right when they got up, 15 minutes later, and then also at night, right before they went to bed. And we did that 3 days in a row from each of these children. So thousands and thousands of cortisol measurements. And so one of the papers we just published was to start the study of how do cortisol measures look in these children, and are they associated with any of these health indices, for example, blood pressure or lipid levels or obesity. And so that was the study we recently published in PNEC journal.
And do you think that the shortcomings of our increasingly sedentary lifestyle can be fixed in other ways, and has maybe also the COVID-19 pandemic exacerbated the situation?
Certainly some of our data suggests that cortisol levels, or the hormonal regulation of sleep, is associated with some of these metabolic syndrome measures, particularly blood pressure. And blood pressure has been increasing in children quite a bit. And the prediction from our data is, since we're showing an association of blood pressure with lower cortisol, so which means as your morning cortisol goes down, that suggests your sleep's disturbed because your hormonal regulation is not going up in the morning like it should to keep your day and night different. Instead, it's getting lower and lower. So you're not getting the cues from the environment to keep your morning cortisol strong. And with that, with this reducing morning cortisol, which is probably, like you say, due to COVID and too much screen time and lack of exercise, their blood pressure is going up. And that's important because blood pressure has been trickier to tie to obesity or other metabolic syndrome measures. It's always seemed to be separate. For example, lipids are very closely tied to obesity. So if you become overweight, your bad lipids go up and your good lipids go down. It's not the case with blood pressure so much. So blood pressure seems to be independent, though it's a key component of metabolic syndrome and type 2 diabetes. And again, is going up in children with time. So that was a key finding from the recent publication, is at least suggests that of those children that have lower morning cortisol, which suggests their hormonal regulation of sleep is disturbed and not as good as it should be, their blood pressure is going up with that.
And maybe from this recent research, what are maybe the key messages for parents to take away?
Well, I think everybody always hears that you should exercise, eat better, and sleep well. And certainly our study contributes to enforcing that. I mean, healthy lifestyles are one of the best ways to prevent type 2 diabetes and cardiovascular disease, which is, the number one killer of adults. And we also know that unhealthy habits in children are carried through to the adult phase and to poor health as adults. So all this is clearly tied together. So to that respect, it's, we were just providing more evidence for what everybody already says is eat well, exercise more, and you should start that as a child and you'll likely sleep better. I think the future ramifications of our research and why we originally did this is more to look at inflammation, because cortisol, that same hormone that regulates sleep, is also the master regulator of inflammation. In fact, the number one drug prescribed worldwide for countering inflammation, or an anti-inflammatory drug, is just cortisol. It's just a derivative of cortisol called prednisone, or all the corticosteroids are just harnessing cortisol to use as a potent anti-inflammatory drug. Well, it then logically is pretty straightforward. If cortisol regulates both sleep and inflammation, that if your hormonal sleep patterns are disturbed, your inflammation should be disturbed and your control of inflammation. So in work that we're now publishing, it's not yet published, we looked at inflammatory cytokines in the same saliva from all these children that we had also studied the hormonal basis of sleep. And again, we found quite strong evidence that as the morning cortisol decreases, which implies that sleep is not as good because you're not getting the cues from exercise and good diet, and then that disturbs the control of inflammation. And that particularly the master controller of inflammation is called IL-1 beta, and that starts going up at night if your cortisol in the morning goes down. So we're seeing more evidence to support this model that the hormonal basis of sleep also is the hormonal basis of inflammation, and that current lifestyles are blunting those peaks in the morning, changing the regulation of inflammation, and it probably follows that that's increasing the rates of pro-inflammatory conditions in children, which is what's been seen over the last decades. The rate of asthma is going way up, rates of inflammatory bowel disease in children going way up, arthritis, any inflammatory state is getting more and more common, both in adults, but particularly in children. And again, if you get it as a child, you're generally going to carry that health problem forward to adulthood. So our findings suggest that the same sleep circadian is also controlling inflammation and then likely controlling the downstream risk of a pro-inflammatory state. So it suggests that if you exercise, you can get your inflammatory state, your circadian rate more in tune and good, healthy, and that will also change downstream blood pressure and likely inflammatory state.
Professor Hoffman, thank you so much for speaking on this subject. Thank you very much, and all the best wishes for your further research. I very much look forward to reading your future publications. Thank you.
Thank you. It's a pleasure speaking with you. Have a great day.